Welcome to the GPS Doula Certification Info Session. I'm grateful that you all are here, that you're interested in certifying with GPS as a doula, that you're in this doula field at all. We are really honored to have you. We love doulas. We support them, we uplift them, we empower them. They are necessary. So we are grateful that you are here listening to this info session. Share my screen. So we are certifying doulas locally and globally, so not just in Washington State, but everywhere, and we are grateful that you are here certifying with us. So About Us GPS Doulas is a doula certification program that is part of Global Perinatal Services, GPS, so you'll see GPS a lot. GPS is a nonprofit organization that provides trusted doula services that will educate, respect, and empower Black refugee and immigrant women and their families during pregnancy, birth, and into early parenting. Our mission is to provide an excellent doula certification pathway based on the competency assessment that ensures that the doulas are competent and professional in their profession roles. We honor doulas. We are excited for you to take this step and look forward to helping you achieve your goals. The process is designed to be a growth experience that will benefit both new and seasoned doulas. We want to recognize doulas as professionals and provide easier access to doula certification. So doulas have been birth workers. This has been an ongoing thing for many, many, many years. They just came up with this doula term recently. We are so grateful that it's more worldwide known now, doulas, and how important they are in the role of birth and the experience that moms have. We're just really grateful that we are able to provide this certification pathway, that it's accessible, that it's easy, that it's affordable. And we really want to honor and uplift doulas as professionals because we are, and we're so necessary in the birth space. So we're really grateful that you are here. So if you bought the packet already, you've probably seen this checklist, but I'm just going to go over the required list once you purchase the packet. This is just you read over the certification and just the steps. So the vision, mission, and value statement, the standard of practice, code of ethics, and core competency guide. Then we need a letter of recommendation. So it could be from a community perinatal professional, someone that you worked with, or it could be from a family that you supported during a birth. We attend a monthly doula certification meeting, complete and submit certification application or competency assessment, and then complete an interview for certification. And then these are some readings that we recommend that you read. It's not required, but we definitely strongly advocate for these books to be read. Ongoing education, which I'll talk about later, is so necessary for doulas. The birth field is always changing. Whether you're at hospital births, birth center births, home births, definitely ongoing education for just birth in general is really necessary for doulas. So we are really grateful to provide some trainings, and since you're certifying with us, you get those perks first. So our fees, the certification membership, which includes the packet, it's a 3-year membership, so it's valid for 3 years. You get a physical certificate in the mail, and you also get a badge. We request a photo, so we added photos to our badges so that when you wear it at the hospital per se, that your face is to a name and that you look professional. The badges are really a really great addition for your certifying doula. And then access to continued education discounts, which is what I was just speaking on. So you will have these discounts because you are now certifying with us. So we have financial discounts for regular members, and now our memberships for Black and Indigenous doulas are free. So the packet is free to you all, and we are grateful to now provide this service because we want more BIPOC doulas in the space. So we're really, really grateful that we are able to now be able to certify them free. So the certification process is pretty self-explanatory. You turn in your completed packet, so it's application. You've listened to this recorded info session. There will probably be a few follow-up questions to make sure that you've listened to the session all the way through. A letter of recommendation, so from a family that you supported or a birth worker, midwife, doctor, nurse, anyone that knows that can vouch for your um, practices as a doula, assessment tools quiz, and an interview. And then recertification is 20 hours of CEUs and CEU opportunity at GPS doulas. So yearly we have different opportunities for continuing education pieces at GPS. They're usually advertised on our GPS calendar on our website, globalperinatal.org, or we have our social media platforms and other things like that. We also send out a mass email to anyone who has certified or purchased a packet with us, that we have we have trainings coming up and that you can register for those. Um, and so these are ongoing with GPS, and we're really grateful that we're able to provide doulas with continued education pieces so that they have tricks in their doula bag, that they have, whether it's breastfeeding supports or different forms of pain management. We are really grateful that we are able to help provide these for doulas. So our perks, you're a certified doula in our doula directory. So we have a doula directory. You will be on there. So you will see other doulas, they will see you. Hopefully you can create a community together. You get discounts for CEU opportunities. You attend our monthly doula cafes, which are really, really wonderful. We have different guest speakers every month from different organizations, different doulas that provide different services, things that we can learn to expand our doula portfolio. And just like life of a doula, sometimes we have doulas speak on maybe things that they're um, other services they provide along with doula support, and things like that. So if you're interested in maybe speaking on a doula cafe or ever participating, it's welcome and open to any birth worker. But if you are interested, please just shoot me an email, and we'll go from there. And then you're also able to submit articles for our blog. So we have a blog. We would really, really love to uplift doulas. We want you to use this space. So if you're a writer like I am myself, and you have a long birth and it had so many ups and peaks and valleys, and you want to share that with us, or just share the life of a doula, how to take care of yourself after a birth, or how to balance family life and being a doula, any of those things, and you're just a writer and you want to share, we really want to open that space to you. So please definitely reach out to me if you're interested in writing your blog. We really want all the doulas to utilize this. I think that doulas need to have our own doula community, and it could span, near and far, but definitely only if you're a doula do you really know what it's like in the doula shoes, and sometimes the burden or even the joys that doula work brings, and being able to vent that and share that with other doulas that experience these things as well, is a really beautiful thing. So I definitely want to open the blog space to you as well. And this is just our contact info if you ever have any questions or need anything from us. That's our standard phone number. This is my email, certification@globalperinatal.org. GPSdoulas.org is our website, so you can always check that on the regular. And I will share another screen. So this is just our website. I'm just going to go over it briefly, just so you can navigate it. So it's our certification is simple, accessible, affordable, high quality doula certification process. So unlike other certifying bodies, we make it really easy. It's affordable. It's very straightforward. And if you ever have any questions or concerns, definitely reach out to me and let me know. I will help you walk through the process. That's why I'm here. So yeah, just a little bit about our website. Let me look. So this is the blog I was talking about. So we talked about National Breastfeeding Month, Professional Development for Doulas, Black Maternal Health Week, which is coming up, how to thrive in doula work, effective ways to prevent doula burnout. That one's real. So definitely this space is open to you all. This is the GPS Doulas directory. So anyone who has certified with us, this is your directory. If you would like to add a photo, do let me know. I think we're going to start adding some photos here as well. But yeah, definitely, if you are interested on the packet, it says that you want to be a part of our doula directory, and we will put your name there. Yeah, so this is just a way to contact us through the website if you have any questions, or you can email me, of course. If we had any events, they will be here. This is probably where I'm going to post this video so you all can look at it, and will be a follow-up with just a few questions to make sure that you watch the video. And I will just briefly go through the packet. If you have not purchased it already, then I will share that with you so that you are familiar with what it looks like. It seems like a lot of information, but it's very straightforward. And hopefully that process is easy for you as well. So when you purchase the packet, this is what it will look like. These are just the contents, your requirements, checklists, the fees, vision, mission, and values, GPS standards of practice, which is very important, the role of a doula, certification and recertification, record keeping, the doula code of ethics, rules of conduct, ethical responsibility to clients, which we take very seriously, ethical responsibility to doula colleagues, ethical responsibilities to healthcare providers of the client, ethical responsibility to doula profession, ethical responsibility to society. So the role of a doula is definitely a responsibility, and we want to make sure that we hire and hold quality doulas. So if you're certifying with us, we hope that it is, something that you're very passionate about, being a doula, and that it, to have this impact that we have on families is a very, honorable thing. And we just want to value you. We want to make sure that education and professionalism are on the forefront of the doulas, for sure. Communication, our core competencies in depth, so the knowledge, professionalism, values and ethics, scope, continuity of care, GPS model of care, GPS doulas core competencies, and we talk about the certification interview. So a little bit about what the interview will look like, professional or client recommendation form. This is just the application certification, so training, competency assessment, date that you attended the session. So make sure that's known. And then we do doula practice stats, referrals, online directory, demographics. So families that you're willing to serve, so that we know what kind of families that you serve or what you would be interested in serving. If there was ever something in the future that you were able to work with us as a doula, that we would know what types of families that you would like to serve, maybe some languages that you speak, or any other like continuing education credits that you already have. Then an annual birth report, recertification, and continuing education form. So dear GPS certification candidate, the board of directors and the certification committee of Global Perinatal Services, GPS, welcomes you As a candidate to the GPS Birth Doula Certification Program, GPS is committed to growing and supporting a community of professional doulas that practice within our standards of practice and code of ethics. GPS is an organization actively working to be an anti-racist and decolonized certification. To the extent we can create equitable, accessible pathways to certification and birth doula services for all communities. GPS is locally and nationally recognized as a leading organization in the birth doula field, and as such, are actively partnering with other stakeholders to create a statewide standard for recertification and Medicaid reimbursement. Quality of doulas are just as important as the quantity of doulas. Therefore, certification is intended for doulas who value the process of peer evaluation, self-assessment, and who support the establishment of the minimum standard for essential birth support, not under the supervision or oversight of other licensed healthcare providers. We are excited for you to take this step and look forward to helping you achieve your goals. The process is designed to be a growth experience that will benefit both new and seasoned doulas. Please read this guide thoroughly. In the following pages, you will find everything you need to complete your application. Benefits of certification with GPS include becoming a member of the community, referrals for our inquiry line, listing in our website directory, and many more. When your certification application is complete, email the indicated forms to certification@globalperinatal.org. Our certification reviewer will examine and reach out to you for your interview. This interview is a means to discuss your experience and how it aligns with the GPS doula's competencies for your birth doula certification. If there are competencies that need additional development, you will have the opportunity to create a plan for further learning and arrange a follow-up interview. Applications for GPS certification are not complete until all elements have been finished. When your application is complete, your reviewer will recommend for you for for certification to the GPS Doula Board of Directors to complete the process. You receive a welcome letter, numbered electronic certificate of certification, and a GPS name tag. You will be able to use the credential format of name, first name and last name, your CDGPS, certified doula. You may therefore use GPS as a credential. Certification is valid for 3 years, and recertification is due before the end of the third year. If you have any questions or that are not answered in this packet, please contact me, and we wish you the best as you begin this important step in your career as a professional doula. So yeah, this is just a checklist that we went through, what the fees look like. So very affordable and free for Black and Indigenous folks. This is our vision, mission, and values again. So our value statement: we welcome and celebrate diversity in all its forms, including but not limited to age, race, gender, ethnicity, sexual orientation, physical ability, religion, language, education, citizenship status, and social economic circumstances. This is GPS standards of practice. So the role of a doula. Doulas are professionals that provide an emotional, physical, and informational guide to pregnant or birthing person and their families. Doulas do not provide medical care. They are not clinicians. For example, a retired medical doctor or an MD who has trained as a doula should not call his or herself a doula while dispensing medicine or medical advice. When a doula is working with a client, they need to wear just the doula hat or be the doula only. So sometimes doula have multiple hats, or they used to be doctors and now they're doulas. So we just want you to wear your doula hat when you're a doula. A doula must make a referral if her client needs any outside a referral for any outside of her scope. For instance, if the client needs a lactation consultant, the doula must make that referral. Doulas provide non-judgmental support. This means they do not impose their values and ideas on their clients. The care they provide to their clients is purely based on the values and goals. Doulas work with medical professionals to ensure that the healthy outcome is obtained for both mom and baby. Doulas help provide correct evidence-based information so that their clients can make informed choices that are right for them. Doulas meet with their clients during labor so that when client deems that they need their doula support, Meanwhile, it's ideal for doulas to join their clients when they are in active labor, but some clients need us earlier. So a lot of times doulas will be like, I'll come get you when you're like 6, 8 centimeters. But sometimes those first time moms, sometimes moms who don't have any family support, they need us earlier and we just have to come whenever they need us because that's just our role as a doula. When they call us, we come. Doulas can accompany their clients to provider visits, but they do not drive the clients to their visits. So don't have the clients in your car while you're going to these appointments. Doulas continuity of care. So a backup doula will provide a backup doula to ensure continuous services to the client if the doula is unavailable. This includes following up with the client and backup doula to make sure that the client's needs are addressed. Definitely have a backup doula. We never know if we're going to be sick, our kids are going to be sick. Maybe we're out of town. Maybe the client gave birth early. Maybe the client went over, past their due date. It's always good to have a backup doula. We might not always need them, but we'll know that they're there. It's also good to introduce your clients to their backup doula so that they're familiar with their face and they know what to expect. They kind of have, that there's some connection there before that they just arrive to their birth. So that's important as well. Referrals. So for clients that need help beyond the scope of what doula's training or knowledge is, referrals are offered to appropriate resources for the best of their ability. So definitely make sure that you have a resource list. Sometimes families need more than just what we can give them, and so that we have to have a warm handoff to someone else. So that's definitely important. Transfer of care. If a doula finds it necessary to discontinue service with an established client before labor, it is the doula's responsibility to notify the client in writing and, if appropriate, arrange for a replacement if the doula so desires. So definitely, if something is going on with you and the client, whether the client decides they don't want to doula anymore or you decide maybe it's not the best fit, definitely try to pass her off to someone else. And yeah, don't leave each other hanging in the wind. Definitely want to make sure that she has a doula that maybe she connects with better. So certification and recertification. Certification, doula certified with GPS will have experience as set forth in the GPS requirements for certification. A vote of the board of directors finalizes certification. Recertification, doulas certified by GPS are required to maintain continuous membership with the organization and to recertify every 3 years to remain status as a certified doula. Continuing education pieces, doulas are expected to complete 20 hours of CEUs prior to recertification. These can be from areas that pertain to pregnancy, baby feeding, or postpartum periods. So any trainings, they don't have to be with GPS. They could be outside trainings, just 20 hours of continuing education. So there's definitely tons and tons of trainings. If sometimes I post them, if they're widely known, definitely continuing education pieces are very, very important. Record keeping. So we want to make sure that we maintain accurate records of each client's relationship and their birth, and make sure that they're HIPAA compliant, so we're not sharing any information with any folks. But it's definitely good to document HIPAA and document what's going on with the births. GPS Doula's Code of Ethics, Rules of Contact, Proprietary. The certified doula will maintain high standards of personal conduct in their labor support capacity and or identity, competency and professional development. The certified doula will strive to become and maintain proficient and professional in their practice and performance of labor support functions through continuing education, affiliation, and related organizations and associations with other doulas. And integrity. The certified doula will act in accordance with the highest standards of professional integrity. So this is an ethical responsibility to clients. So definitely just to be reliable, to respect clients' privacy, ethical responsibility to doula colleagues, respect, fairness, courtesy, and dealing with other colleagues' clients. So, in the doula field, definitely backing each other up and supporting each other, uplifting each other. Ethical responsibilities to healthcare providers to the client. So, respect, fairness, courtesy as well. Recognition of clinical responsibility. Ethical responsibility to the doula profession, maintaining the integrity of the profession. Um, Ethical responsibility to society, promotion of maternal and paternal and child welfare. Very, very important. The core competencies in depth, communication, active listening, and critical thinking, non-judgmental communication, supporting client self-advocacy, consent, cultivating relationship, conflict resolution, create problem solving. Values and ethics, doula model care, standards of practice, code of ethics, cultural humility, race, privilege, and power, gender identity, personal integrity, accountability, boundaries and legalities, knowing when to refer. Just the knowledge, professionalism, scope. The doula accompanies their clients continuously while in labor, gives emotional and physical support, suggests comfort measures, and offers encouragement and suggestions for both the client and any other support people. Whenever possible, the doula delivers perinatal and postpartum emotional support, including explanation and discussion of practices and procedures throughout the course of service. Um, Limits to practices. So the doula does not perform invasive clinical tasks such as cervical exams, injections, IV care. Doulas who have received training may assist clients with performing non-invasive clinical care tasks such as blood pressure measurements, temperature checks, assessments of postpartum bleeding, and newborn weight checks. These tasks are conditionally appropriate when recommended by clients, medical care providers. The doula does not initiate non-invasive clinical care tasks nor interpret the results. Also, advocacy. The doula supports each client's values and goals during prenatal conversations, interpartum and postpartum discussions, and birth planning. The doula supports clients' advocacy of those values and goals at all times. The doula supports communication and shared decision making between clients and their care providers by encouraging clients to ask questions, share values and goals, and incorporate changes and plans. Doulas who have received training have demonstrated skill and experience and/or have longer term culturally congruent relationships of trust, such as community-based doulas or outreach doulas, may speak on behalf of their clients. This is always conditional on the permission of the client with the goal of client empowerment, self-advocacy, anatomy, and agency to cultivate an equitable, safe environment. Doulas do not participate in activities that decrease clients' anatomy, agency, or ability to self-advocate, including speaking on behalf of the client without their permission or making decisions for the client. So this is a big one. Definitely want to advocate for our clients, but definitely don't want to step in as their speaker. We want to make sure that they speak up for themselves and that we give them the educational pieces, the information that we have as birth workers, and they make the decisions that they want for their bodies and their birth. Definitely, if there's times at the hospital when they feel overwhelmed with the doctors and the nurses asking questions and things like that, we want to make sure, we need a few minutes and we talk with the client and the doula alone and just make sure that if they have any questions, they probably trust us a lot. We've established a relationship and they can ask the questions, the family can ask the questions to the doula. We can give our recommendations, but ultimately they are the decision makers in their care. So continuity of care, just backup doulas, referrals, certification and recertification again. GPS model of care. So our values and ethics, doula model of care, cultural humility, boundaries and legalities, professional integrity, accountability. Those are all big words, sorry. Professionalism, communication, knowledge, and continuity of care. So these are all our very important model of care, GPS. This is our competencies yes or no quiz, so make sure you fill that out, yes or no. All these questions when you receive your packet and you submit the packet to us, all these should be yes or no in those boxes. You'll have an interview and we'll talk just a little bit about your background as a doula and things like that. You don't need anything, but just make sure that you attended this info session, that you submitted your packet and your recommendation letter, and we'll go from there. Professional client recommendation form. So GPS doulas requires a letter of recommendation from either a community birth worker who knows you and your role as a birth doula, or a family you've assisted as a birth as part of the certification process. Other doulas, midwives, nurses, physicians, lactation educators, and consultants, and other birth professionals are examples of birth professionals. So definitely reach out to us with that information. This is the application. So where you took your training, let us know that, how many hours of training, the time that you did the certification. Make sure that you have all this checked off. Doula practice stats. So your referrals, if you want to be a part of our online directory, your demographics, make sure that you sign it at the bottom as well. This is a basic knowledge assessment tool. So definitely fill those out and send that back with the packet. This is the continuing education form. So definitely, if you want to be a part of it, we will have this on file. So we know to reach out to you for further things. And yeah, that is what I'm going to stop sharing my screen. I'm so glad that you all are here, that we went over some of the credentialing, GPS certifying information. I am grateful that you are interested in certifying with us, that you want to be a doula. Doulas are so important. So we are very grateful that you're here with us, that you want to pursue doula field. That maybe you're already a doula and you just want the credential piece. We are grateful for that as well. Doulas are so needed and valued. If you have any questions, definitely reach out to me. My name is Taylor. I am here for any of your needs at GPS. I am glad that you attended the session. Thank you. Take care.